afternoon, my name is Victoria and I am an Assistant Manager at Public Health England. I'm here today to hopefully alert you on an issue that has been around for a long time, which is mental health. We have chosen to focus on the effect that social media has on the mental health of young people. Public Health England is an executive agency of the Department of Health and Social Care, providing government, local and NHS care. At Public Health England, we exist to protect and improve the nation's health and well-being and reduce health inequalities. We are responsible for promoting healthier lifestyles, advising government and supporting action. A serious concern here in the UK is mental health, specifically amongst young people. There are many factors that initiate, enhance and develop mental health issues. The Mental Health Foundation states that mental health problems affect 1 in 10 children and young people. They include depression, anxiety such as the fear of missing out, and conduct disorder. Additionally, academics at Imperial Research suggest that adolescence is a time of increasing vulnerability for poor mental health. However, the study found that sleep disturbance is an important risk factor for the development of depression during adolescence. Sleep deprivation has been defined by the American Sleep Association as obtaining inadequate total sleep. This occurs when a person is in a chronic sleep-restricted state, causing excessive daytime sleepiness, fatigue, clumsiness, and weight gain or weight loss. In addition, ASA adds that being sleep deprived affects both the brain and cognitive function. According to the National Institute of Neurological Disorders, sleep is as essential to survival as food and water. According to author Jason Bury, sleep deprivation has developed due to young people feeling inclined to be social, suggesting that this could be because socialization has made it acceptable for youths as young as 12 to have mobile phones. Nevertheless, it was stated by scholars such as Judith Owens that sleep loss is a threat to the academic success, health and safety of young people and has become an important public health issue. Writer Emily Furr from the Education Policy Institute raised a concern based on a study of 16 to 24-year-olds, which was conducted by Ofcom in 2016. It was highlighted from the data that 72% said that they had missed out on sleep because of their online habits, 60% agreed that they had neglected their schoolwork or studies, and 78% had been told off by their parents for spending too much time on the internet. Sally Real, an education correspondent, stresses the importance of sleep deprivation and that it has become a growing problem, specifically in schools, with pupils struggling to concentrate in lessons due to the lack of sleep. In addition, doctors have previously reported a dramatic increase in children with sleep disorders. The NHS data shows hospitals' attendances have increased dramatically over the last 3 years. The image shown above is from a study conducted by Kep Kilo and Dr. Royota Kanai. They reveal that people who frequently use several media devices at the same time have lower grey matter density in one particular region of the brain compared to those who just use one device. Public Health England has chosen to focus on 11 to 16-year-olds. Children are gaining access to social media sites at a younger age, which could expose them to content, people or situations that are out of their depth and which they're not emotionally prepared for. We believe that targeting children when in their first year of secondary school up until their last year is beneficial as they begin their school journey educated in sleep deprivation and they leave with the same information ready to help them in the big world. Sleeping well is as crucial to a human being's health and well-being as having a healthy diet or exercising frequently. However, while we're generally exposed to government campaigns which encourage people to eat their 5 a day, live well or change for life, the nation's sleeping habits are largely ignored. Public Health England has chosen to focus on 3 research objectives that aim to educate rather than lecture young people on the ways in which social media can affect their mental health negatively. Number 1, to understand whether there is a relationship between age and the level of involvement in social media. Number 2, to explore the rules of social engagement put in place by parents and carers. And number 3, to investigate whether secondary schools in the UK are providing students and parents with enough programmes concerning the link between social media and sleep deprivation. Research objectives stated will help Public Health England to improve current policy decisions on the chosen issue. All 3 objectives together aim to spread the most awareness on mental health issues. By reinforcing programmes such as healthy sleeping, this will help people to understand that getting the right amount of sleep is just as important as eating the right food and getting enough exercise. Our priority at Public Health England is to make young people's health a priority. Adolescence is the time of greatest vulnerability from the standpoint of sleep. Sleep deprivation is a growing problem in schools and we want and need that to change. We hope that this is a topic that urges everyone to try and help. Thank you so much for your time and we look forward to hearing from you. Please, if you have any queries, do not hesitate to contact me. The details will be on the slide below.